Good afternoon. Good afternoon. Thank you so much. At NMQF, we've been really fortunate to have a really spectacular team. When COVID hit and we went virtual, I decided that we were going to be a virtual organization and began recruiting staff from all over the country. And I want to take a moment to introduce to you most of the staff at NMQF. There are a few that are not here because they do the hard work. I get to stand up here and pontificate, but they're the ones down in the trenches who do the first and really bringing all of this together. And I'm going to start with Brandon Garrett. Ask him to come up, Brandon. So anybody knows that Brandon's my chief of staff, and he just does a fabulous job. Keiko Purnell, come up. Keiko's been with us. She's involved. She's now part of our policy shop, and we're really excited to have her. Kanisha Adams is my assistant, my right hand, tells me what to do. Anybody who knows that if you want to be on the calendar, Kanisha is the one. Ashley Hill has just come aboard. Ashley, come and join us. Oh, there she is. Great. All the talk about the Faith Health Alliance and the Barbershop Alliance and the Beauty Shop Alliance is Laura Lee Hall. Just really been a tremendous partner with us, Laura Lee. And then there's Gretchen Wortman. Gretchen and I, we get on the phone and we talk all the time about policy. How do we turn this system around? And Gretchen Wortman heads up our policy program. Margot Payne has been part of our business part of NMQF. Margot, I think, has probably been here about 20 years. And so she's been a very important part of our organization. Leo Zhu. Leo is our chief statistician. Anybody who knows we're crunching the numbers, Leo is the one doing that. Ajua Comatid is our new communications director. You see us on social media. That is Ajua and her team. Venkata Dinesh Chinchilla is our data manager. We are building a data lake of over 5 billion patient records, collecting data on 160 million lives a year, and he's the one who's helping manage that system. Jennifer Matisse is one of our new MPHs. We got a whole lot of MPHs because we are definitely about the science, and she's writing and publishing papers all over the place. Chinosa Okachukwu works with Laura Lee Hall, and she's the one who's really managing the Faith Health Alliance. Christina Edwards is our director of clinical trials. So yeah, we do clinical trials. We are training community clinicians to do clinical trials, and Christina is driving that. Kayla Emeru is helping us to take our data and partner with community-based organizations and others, because this is a data-driven exercise, and we're trying to make sure that data gets out there. Bakari Wilkins, if you've heard about For Your Health News, so it's like Apple News or Google News, except that it's focused on minority health. I encourage you to go look at the great work that he's done in bringing For Your Health News out there. Shantoya Hensley is another one of our MPHs. This is a data girl. You talk about grinding it out, cleaning up the data, making sure that it's accurate. We get into some arcane discussions about data management and data cleansing, and Shantoya is doing that. A new member of the team is Shantoya Hartswood. She's another one of our MTHs and working with our program to train community clinicians. We have an FDA grant, and she's one of the leads on that. Anna Norton has just come aboard. You saw Anna today. We are really excited to have Anna as part of the team. She works with Laura Lee Hall. And then finally, Erdell Caesar. Where's Erdell? Oh, there you go. Right. She's come aboard as part of our financial management system. There are a few others that are not here. And I got to give a shout out to Cecilia Masters. She's our grants director. She's a fireball, and she's done really fantastic stuff for us. Oh, Kia. Did I do that? I didn't do that. No, I did not. Oh, please. Forgive me. Kia is part of our communications team. This is the NQF team. We are diverse. We are women. And we are very intentional. This is the team that drives NMQF. And really could not do this work without them. We are so excited about this team, and we're growing. And as I said, we're very intentional about what we do. So thank you again so much. Okay. All right. I want to invite Dr. Megan Thompson to come up now, please.
Good afternoon, everyone. Thank you for attending this year's National Minority Quality Forum. My name is Dr. Megan Thompson, Senior Health Policy Advisor for Congresswoman Robin Kelly and the CBC Health Braintrust lead. I am your MC for the Congressional Awards Luncheon. I hope you have all enjoyed the morning sessions, and I know that you have acquired tangible action items that you can take back to your respective organizations to improve health quality outcomes. I am honored to join you today as we recognize these health equity champions that make a difference every day in people's lives. We are at a critical time, one which needs all of us to act with the commitment that the awardees today have demonstrated. The promotion of health equity means that we are consciously making decisions to eliminate health disparities by addressing those factors that are avoidable and unjust. We must continue to insert ourselves into the process to ensure that the various health reforms we seek actually builds an equitable system for everyone. I am encouraged today because everyday people are working to make a difference to create the health system we all deserve. We will learn about and hear from three amazing people who are at the forefront of eliminating health disparities and are more than worthy of these awards. So, our first honoree is Dr. Crystal Riley. Dr. Riley is the Director of Federal Government Affairs for AbbVie. Dr. Riley is an awarded and published clinical pharmacist and government affairs professional with extensive experience in healthcare delivery. Give us 1 second. have it, Congresswoman Robin Kelly. Please give her a hand. All right. Okay, back to our first honoree is Dr. Crystal Riley. Dr. Riley is the Director of Federal Government Affairs for AbbVie. Dr. Riley is an awarded and published clinical pharmacist and government affairs professional with extensive experience in healthcare delivery, policy, and legislation. Throughout her career, she has worked on a range of issues, including clinical and health economic and outcome research determinations, healthcare reimbursement, delivery and payment systems, patient safety, healthcare disparities, information technology, as well as intellectual property and antitrust. Dr. Riley earned her Doctor of Pharmacy from Howard University in Washington, D.C., a dual MHA MBA through the University of Maryland, and holds multiple professional certifications. Outside of her day job, Dr. Riley is a clinical and policy adjunct professor for master's level students at Grand Canyon University and NYU Wagner, respectively. The legislative committee chair for the Sickle Cell Disease Association of American Board of Directors is an active member of the Prince George's County Medical Reserves Corps. She is also an avid tennis player, an enthusiastic golfer, lover of Formula One racing, and prides herself on maintaining an open inbox policy for any student interested in healthcare and policy. Dr. Riley, thank you for your dedication to health equity, and we present to you the Outstanding Corporate Leadership Award.
Hi, everyone. Honored to be here with you all today. So on any given day, we wake up and in some way or another, try to navigate a very complex and imperfect healthcare system. Those imperfections are magnified when it comes to underserved, disparate, and marginalized populations. And it's frustrating because we can see the flaws and we see the impact, and we are challenged to come up with solutions that are both effective and equitable across a number of determinants. But I am heartened because we have members like Congresswoman Kelly and staffers like Dr. Thompson and Dr. Ray and organizations like NMQF that are working to find those solutions, always keeping patient health as their North Star. So I'm optimistic that at some point in the future, we are going to be able to find those fixes to the flaws in our healthcare system so that we can make patients whole. So I am honored to be here again today. I know that we have a lot of work to do, but I'm very much looking forward to continuing this important work. So on behalf of myself, AbbVie, and our patients, thank you for this recognition, and I look forward to working with all of you.
Dr. Riley, thank you so much for those words, and thank you for all that you do. Our next honoree is Dr. Amber Ray. Dr. Ray is the Deputy Legislative Director for Congresswoman Lisa Blunt Rochester, who serves on the House Committee on Energy and Commerce Subcommittee on Health. As a pharmacist working at the intersection of public health and public policy, Dr. Ray understands that we must improve the conditions in which people live, work, and play to make healthcare interventions most effective. She has worked on legislation to promote healthy child development, reduce healthcare costs for low-income seniors, and help communities across the country create the infrastructure for healthcare and social service providers to communicate, coordinate, and track outcomes for their patients. Her policy interests include health equity, maternal health, pediatric mental health, and healthcare workforce issues. Dr. Ray hails from North Carolina and is a proud Blue Devil, receiving her BS in chemistry from Duke University. Following her time at Duke, she received a Master of Public Health and a PharmD. She began her professional career at the University of North Carolina at Chapel Hill, where she worked to improve health care quality for health systems and taught first-year PharmD students. Prior to joining the Congresswoman, she served as a staffer for Congressman Earl Blumenauer. Dr. Ray is active in her community, serving as a big sister at Big Brother, Big Sister. For all of your dedication and commitment to health equity, we present to you the Chairwoman's Congressional Staff Leadership Award.
Good afternoon, everyone. I heard we have some Blue Devils in here and some Tar Heels too. Okay, I see you. I just want to thank NMQF for holding this really important summit. I want to thank Congresswoman Robin Kelly and her staff for this recognition. It truly means a lot to me. But I want to thank my boss, my member, Congresswoman Lisa Blunt Rochester, because at the end of the day, as congressional staffers, we are only extensions of the member that we work with. So I'm very fortunate that she holds the ideals that I do with respect to health disparities and healthcare access and health equity, and that she allows me to work on these kinds of policies and to pursue solutions for vulnerable Americans. So the theme of the summit, as I understand, is reimagining our healthcare system to protect the most vulnerable. And this is important for me both professionally and personally. You know, like I said, I'm very grateful to be working for a member who espouses the same ideals as I do, but who also sits on the Committee of Jurisdiction over most of healthcare issues. So we have really unique opportunity and perspective to work on legislation that directly improves health equity and closes health disparity gaps. And, you know, I think you'd be probably surprised to know, if you really looked at the records of members and listened to what they talked about, there aren't that many members who will go out of their way to promote policies for vulnerable populations and to be a voice for those populations. So it's really important that we have members like Congresswoman Kelly, Congresswoman Blunt Rochester, who are in these positions who can carry this work forward. Personally, these issues are very important to me because, like many Americans, I have family members who have issues with healthcare and, you know, are subject to health disparities. For example, my grandparents live in a very, very rural part of Southern Virginia. They are dual eligible Medicare, Medicaid beneficiaries based on income. Where they live, they don't have sidewalks. So whenever they go to the doctor and the doctor tells them to go outside for a walk, that is literally not feasible for them. You know, however, I've seen the power of federal programs and how those have helped really save their lives and keep them alive. So for example, low cost access to healthcare. They've got a transportation benefit that will pick them up and take them to their appointments, but also the grocery store or wherever else they need to go. Federal policies that help them pay their energy bills, policies that help them afford food. You know, these are really life-sustaining policies that I think it's up to all of us to continue to fight for, because there are a lot of Americans who really depend on them, contrary to what some people might have you believe. So it's for these reasons that I'm very grateful to be in my position, to sustain my work, and why I'm so grateful to be receiving this recognition. Thank you.
Dr. Ray, thank you for those kind words and thank you for everything that you do. Next, we will have Dr. Puckering come and present the next award.
Thank you. First, I must give recognition to Congresswoman Kelly. She's got a wounded wing here. I think she was playing soccer or some such. But she and her staff have really been tremendous partners and on the work of trying to get healthcare equity. And so we really do appreciate the great work that she does and leads in Congress. So by way of introduction to our next award, I have to tell a little bit of a story. And the story is about Flint, Michigan. So some of the folks in Flint, Michigan went to the vice president, I think it was last fall, about a potential cancer cluster from the water exposure that they had. The vice president sent them over to the Office of Science Policy because they wanted to get research done to determine whether or not they had a cancer cluster as a result of the environmental exposure from the water. We got an outreach from the White House asking us if we could help and work with them because they were looking for federal support to do the study. And anybody who knows the federal government means it takes a moment in order to get that kind of support done. And they wanted to do something more immediate. And we were pleased to take on that assignment and reached out to some folks that we work with, a company called Exact Science. We reached out to them and asked them to help. Centene was another group that we reached out to, as well as to Genentech. We were able to pull together a meeting for them, and our team, and this is where getting hyperlocal really got hyperlocal. Our team went into Flint and met with the community there, and really it was a listening session. We were there to listen, to understand the nature of the challenge that they were facing, and there was a lot of disappointment in the community. A lot of people came in and made a lot of noise and then went away and didn't do anything for them. And so we had an opportunity to just take a moment to listen what the community needed. And we then reached back to Exact Science and said that we need to do a health fair. We need to bring the community together. And as it turns out, the president of Exact Science, Kevin Conroy, grew up in Flint, Michigan. And so his father was a legislator and still very much alive in Flint. And Kevin made a deep commitment to Flint to get things done. And we learned just a tremendous amount about what was going on in Flint, but in other communities around the country. And probably what I missed telling you in the story, in terms of the White House reach out to us, we were part of the Cancer Moonshot that the president had launched, and this was a conversation about the Cancer Moonshot in Flint, so it was really the response of Exact Science in the moment, not questioning and saying, yes, of course, we want to help a community. And so it's really with a deep sense of thank you. I'm sure the folks in Flint would want to convey that. And it's an example of good corporate citizenship. Sometimes you just gotta do something, right? And not sit on the sidelines. So Dr. Travella Ellis is gonna come up and accept the award for Exact Science. We're so pleased to get it.
Good afternoon, everyone. Thank you, Gary, for the story and the accolades and the honor. On behalf of Kevin Conroy, our CEO, and the 6,000 team members at Exact Sciences who work so hard to bring great tests to patients every day, I'm honored to accept the award. Many of you may not know Exact Sciences as a brand, but we are the makers of Cologuard, the talking white box that you see on your TV pretty often. And we have a host of a portfolio of tests that look to screen for cancer earlier and guide treatments for tough and life-changing decisions. I love the theme of the conference in terms of protecting the vulnerable, because as the director of health equity, it was important that we establish our health equity principles around understanding vulnerability. understanding that each of us in this room may have vulnerabilities, that people around us and communities that we know and trust and that we advocate for have vulnerabilities. And it's not a one size fits all. And so cancer as a disease affects all populations, but the disparities come in how cancer is diagnosed, the prevalence of it, and the treatments and the outcome. And so we as a corporate partner are committed to increasing awareness, increasing education, showing up for communities like Flint, giving access to Cologuard kits, and advocating for policy change for coverage. We are quite excited about our work with clinical trials, increasing inclusion upstream, analyzing our protocols and diversifying our partnerships, and then being a responsible partner like to the Cancer Moonshot, thinking about our sustainability efforts through policy and hyperlocal change. So we are really honored to be part of the Cancer Stage Shifting Initiative, to be part of that solution, that public-private partnership that changes the model of how we do healthcare and how we improve outcomes for our communities. We want to increase evidence base, inform best practices, and really address not only the social drivers, but also the political determinants that undermine our community's health. So again, grateful for this honor, humbled by the award, and let's continue to do great work.
So I just want to add a little of the after story to the story in Flint. On Wednesday, we will be at the White House hosting a listening session for the White House on cancer in minority communities. What we hope to come out of that conversation is hopefully the largest demonstration project on cancer in the United States. We have a lot of learning to do, and there's a lot of really interesting science that's being developed. And I won't take all of our time here to tell you about it today, but to say there's something called multi-cancer early detection screening. They screen for 50 cancers at one time with one blood draw, and they can find patients before they are symptomatic, even before you know cancer. I heard that question about pancreatic cancer earlier today. We don't have a screen. We now have a screening. We actually now have a screening for pancreatic cancer that will find it before the patient is symptomatic. What the challenge is, just super. Exact Science is one of the companies that are working on it. There are others. But here's the challenge. Our healthcare system can't figure out how to pay for it, right? And so what our concern is, and the reason why we're jumping into this and bringing a lot of our friends into the conversation, is because one of those screenings is in the marketplace today. It costs $1,000. And if you got $1,000 a year, you can go get yourself screened and find out if you've got cancer in its very early stages. But what it means for poor people is that they're going to end up with metastasized cancer, right? While people who can afford the $1,000 won't. That's intolerable. We can't have a healthcare system that looks that way. And so the urgency is now, because the screenings have already started. They're already in the marketplace. And so what we want to do is to put demonstrations in community to show the effectiveness. And there's a lot of learning, a lot of things we have to learn about how to use these new tools, particularly since many of our therapeutics are dealing with metastasized cancer. And so how do we use new medicines at stage 1 and 2 cancer? I think this is the beginning of the end of the war on cancer. I think by the time we get to 2030, 2040, think about this for a second, cancer will be like HIV. We'll treat it as just a common disease that we're able to manage. That's what we're talking about. That's what the reimagining is about, is to be able to take this kind of technology and get it to community expeditiously. And I'll end here with the words of John Kennedy. He was asked, so why do you want to go to the moon? And his answer was, because we refuse to wait. It reminds me so much of Dr. King's words in the Birmingham jail when people asked him, so why don't you wait? And he said, because we refuse to wait. And that's what this is about. We refuse to wait. We want to make sure that we're able to take this science and technology and get it to community as expeditiously as possible. And that's what the Reimagine is. So thank you so much.
That concludes the luncheon. Can you give our award recipients another round of applause, please? Thank you all for being here, and I hope you enjoy the second half of the day.